Welcome to the Crush Your Sugar Craving Summit. I'm Michelle Jolly with Healthy Horizons Coaching. Today we'll be interviewing Dr. Supriya Shetty. Dr. Shetty is a graduate of New York University School of Dentistry and has embraced holistic and biological dentistry. Intuitively, Dr. Shetty understands that health-centered dentistry is in the best interest of the patient and considers it her mission to restore and maintain the natural health, function, and beauty of her patients' mouths. Originally from India, Dr. Shetty lives with her 3 kids and husband in Brookfield, Wisconsin. Her hobbies are traveling and music, and she is fluent in several languages. She is a firm believer in continuing education and continually working to improve her dental skills. Let's welcome Dr. Shetty. Thanks for being here today. So good to have you.
Thank you for inviting me. I'm so happy to be here.
Yeah. Well, we got a little bit of your background, but I like to start with kind of how did you get to this place? What's your story? How did you get into dentistry? Why is it important for you?
For me, I got into dentistry because of my orthodontist. I grew up in India. Dentistry is expensive, not just in, it's around the world. Everybody is like, I think it's expensive because we don't give importance to it. We weigh something else. But my parents were my dad was very into dentistry. Like he was dental health. He was very important for him. So he was and me being a female, so he took me to an orthodontist, made sure that my teeth were lined up. My orthodontist was the most simplest person and very down to earth person. And she had that nice professionalism that I always admired her. So there was nothing reason behind I wanted to be a dentist, but I really wanted to be a doctor as I was growing up. For me, being a doctor, helping people get better felt very good. Helping others was something that I really gives me satisfaction till today. It could be in any form. I wanted to be a doctor, but with the situation, my parents wouldn't let me go very far, so I could only go to dental school. So ended up in a dental school, and thank God that I went to dental school because I could use my fingers and the medical part together. And with time, went to dental school in India, came here again, went to dental school in NYU, got my graduate, moved to Milwaukee, and then I was interviewed by Dr. Mann, who actually is the founder of Integrative Dental Solution. So, started as an associate, and I embraced the whole holistic environment of dentistry with him. Being raised from a holistic background by my parents, especially my dad, it was like, this is what it is. And especially like taking care of teeth without using amalgam, which is mercury filling. It was going to school twice in dental school. I never questioned like this mercury is bad. I never asked myself, like, you never think about it. But then after, with this holistic day, I was like, why did we ever be so brainwashed about this thing? And like now, so that's how I started with holistic dentistry. But I always grew up with Ayurvedic and homeopathic and background. For me, with my parents, are very holistic. So it was very nice for me. This was like a second nature for me.
Yeah, great. Yeah, we need more of that in the dentistry industry.
Absolutely.
Yeah. So you work in the biological dentistry, looking kind of the relationship between our physical and dental health. Can you tell us a little bit more about what that means and how it might benefit a patient?
Absolutely. As a dentist, we grown to think of only about teeth, but we forget the rest of the part of the body, the teeth, which is in the head, and the rest of the linking part. Biological dentistry, it links your dentist to understand the whole perspective of your health. Your teeth, every tooth in your mouth is related to different organ. I don't know if you're aware of the tooth meridian chart. Weston Price talked about it. Dr. Hal Huggin talked about it. The IOMT too, which I'm a smart and accredited certified from IOMT. It's very hard to say that fast, but It is biologically where the dentist or the doctor of your teeth relates different things. For example, when a patient comes into our office, we do like a 3D scan. In the 3D scan, we're able to see the skeletal version. We can see able to see the whole root canal and see some infection, see the sinuses, see the airway. Then, as from when we do the oral examination, in addition to intraoral cancer examination, we also see the tongue. The tongue is a map to your health. It's, you can see, especially like when you see, look into Chinese medicine, you see the tongue and the different areas of the tongue is divided into, you can see like the tip of the tongue could be inflamed. It could be something related to the heart. You could see a quivering or a shaky tongue. You could say there's an there's an emotional stuff inbuilt. And most of the time when I'll ask my patients, do you have something going on? They're like, oh, you know what? I have something. I have been, like, for example, as a patient will be talking about, I was just diagnosed with this, and they would not even have mentioned in the medical history. And I'm like, okay, you could have told me that. And I was like, but it makes a lot of, it may not be 100% right, but it is a guide for me to look in that direction. So I really, this is what where a biological dentistry stands out compared to a conventional dentist, where conventional dentistry is coming up, where we are talking about biocompatible material, we're talking about airway, we're talking about large tongue, we're talking about how we want to make your arch wider, which Weston Price talked about in the 1960s, and we're talking about it now as so it was, conventional dentists are talking about it, but little later than when we should have all talked connected. And so I feel like dentists should be a part of medical school.
Yeah. That's very interesting. I've heard a little bit about that, but don't know too much about that napping and everything, and the tongue and everything. Yeah. So, like, one of the things with the sugar summit, we kind of get people that have diabetes and things. I was kind of curious how that would that show up in your teeth, or is that something you'd find a different way? Or
Yeah, see, now diabetic, especially even in the conventional dentistry, we would be concerned. We would say, okay, a person who has inflamed gum, who has gum disease, it could be gingivitis, which is just like inflammation of the gum, or it could be periodontitis, which is it is the foundation of the gum is compromised, the bone and the gum. So we used to say, even in conventional dentistry, we do see a link of that gum disease to being diabetic. It was like a person who was diabetic would have gum disease. But from holistic purpose, also now, even conventionally, we're changing. If a person is having gum disease, is it a biomarker for a person to have some other form of a disease, like being diabetic or having cardiovascular diseases? So we could see, is this a red flag for us? So a person who diabetic has very inflamed gums, especially also on the tongue. You will see the border of the tongue could be red and rolled. Is it that was talks about the kidney? So you can see some, just in the mouth, you could see there is some inflammation going on. And inflammation is not, it's not restricted. It could be localized, but it is most of the time is very systemic, and the bite is coming. So as it comes superficially, it is there is something going on much deeper.
yeah, very interesting. Another thing I kind of wonder about is kids having sugar, and toddlers and things. Um, when they have sugar, how soon does it start affecting their teeth and their health? And is there amount that's max amount they should have, or how long should they try to keep the kids away from sugar, at least?
For all of us, for kids or adults, I think sugar is bad. And sugar can be refined, processed, or natural sugar. So now natural sugars, we always get natural sugar from food. I think we do need sugar in our system. We cannot be completely depriving ourselves of sugar, but we have to take the natural sugars. My kids always will say, you always say sugar is bad, but we get sugar from our apples, we get sugar from our bananas. And I say, yes, that is true. You know what, we do it. But overdoing an apple is not good too for your mouth. It's like you're overdoing your apples. There's a lot of sugar that can break down your teeth. I'm trying to be very, well, I'll be talking very lame so we can, all of us can, I'm not going to use some, but even it'll break down your teeth, sugar, apples, and, any form of natural food
Mhm.
product. But when you take processed sugar, it goes through a different form of breakdown in our body compared to a
Mm.
natural sugar. And sugar is like another substitute, and processed or refined sugar is another substitute, is equivalent to having heroin. That's how bad it is. It gives you that excitement. It goes and go, it gives us an excitement as just like it. If the heroin give you, but you do, the white sugar that we talk about is not a good substitute. Now, how long does it take to break down? There was a dental school did this little study where they put like a tooth and a can of Mountain Dew can. It took about a week for the sugar to for the tooth to disappear. Not much. So it's like baby teeth are smaller compared
Yeah.
to adult teeth. So we will always, it is definitely when adult, like kids, if you have too much sugar, they're very prone to having cavities. But sometimes it's also when you eat, it's not just, sometimes you'll see a person will eat a lot of junk and they're like, they have no cavities. And the other person would eat brushed really good and they will have a lot of cavities. It's
Mm.
also related to your body pH. So if you have a very acidic overall body, you are more prone to having cavities compared to a person who's in an alkaline
Mm.
state. So your diet does make a very big factor for you to be healthy. And so I would definitely say avoiding refined sugar would be very important, but also at the same time, limiting the amount of fruits we eat was also be
Mm.
important.
Yeah, and I suppose fruit juice is even worse because that's more concentrated. You have the fiber taken out. And is there
Right.
anything else that people might not suspect that could have sugar and mess with the pH?
I always tell my patients anything other than water causes cavity. So
Uh,
because everything has sugar, right? Like carbs has
yeah.
sugar. So we do break down and ultimately to sugar. So everything has sugar in it. Is how much proportionating yourself, making sure you eat proportionate, like, and at the same time keeping your mouth healthy by keeping it clean would also be
Mhm.
very important. Like if you go back, I don't know how many of aware, but Weston Price talked about eating like in more like raw diet, like you eat
Mm.
food that we chew more than we just swallow. It's not helping. It helps us to grow too. So um I go eating like eating a lot of greens and like the fibrous food. They help us cleaning our teeth too. So I was just talking to a patient one day, like celery, it's got that nice fibrous. So you're chewing a
Mm.
celery will really help you to clean your teeth really well. At the same time, it's got a lot of trace minerals. Celery is a poor man's salad, but has a rich in a lot of minerals that we don't even get here, especially when we
Mhm.
drink a lot of we get what is it, filtered water, the reverse
Yeah.
osmosis, we really take out all our minerals away from reverse osmosis. So like I would say eating celery after a meal is a good cleanser. That's my recommendation.
Yeah. Yeah. I haven't heard that before. Yeah, that's a great idea.
Hmm.
Yeah, it's interesting how it cleans your
And it's
teeth.
alkaline too. It's
Yeah.
alkaline body too. Yeah. Yeah.
Yeah. Well, speaking of food and diet and things, are you kind of in the abstinence or moderation camp of sugar? And then kind of what does your diet look like or your food plan?
My own,
Yeah.
I would say so there even though I'm a dentist, I can still claim I crave for sugar too. I love sugar,
Yeah.
but
Yeah.
knowing that it's bad, like but also when again going from the biological is knowing what I know. When I'm craving for sugar, I know I have done something wrong to myself,
Mm.
right? Because I'm like, okay, why am I craving a lot for sugar? Is it a lot of anxiety or stress? One could be there. And also when probiotic, which is down in our mouth and also down in our gut, the second brain, is did we mess it up there? Because if you have
Mm.
a high candida, the, I
Mhm.
sound different when my accent kicks in. But that could be also when you're high in your flora of candida, you crave for sugar. So when your kid is craving for, has a sweet tooth, they're like, oh, I have a sweet tooth. There is something beneath it. You say, okay, that's something you're saying. Like, when a patient comes and tells me, I have a sweet tooth, I'm like, okay. And I'll look at the tongue will be coated white most of the time. You're like, that's saying, okay, they have a high candida going on. And that candida could be many things. It could be because of a health condition. It could be because of the gut being weak, or many things. Then you look deeper down to find out why it is happening, or work with their MD or the naturopath, and see, and you'll see most of them are getting worked on the candida, and they're on a good probiotics, and they're working on it.
Yeah.
And so
Good.
going
Yeah.
back to the question of so I eat sugar once in a while, but not a big fan of it. I don't drink any juice.
Yeah.
I do smoothies in the morning, but right now I've changed. I have a celery in the morning, but I do lemon water first thing in the morning. Then I have a celery juice after an hour. But I very much into still maintaining my ancient diet. Like I stick to my Indian food habits. So I
Mhm.
do intermittent fasting, and I do 2
Ah,
meals a day. So yeah.
yeah. Yeah. Nice. And the lemon water. I was going to ask that. I try to do that in the mornings too.
Mm-hmm.
How does that affect does the lemon deteriorate your teeth
Mm-hmm.
covering, or how do you do that?
I have not done any research, but I have a lot of the reading I do, and so that's based on that. Lemon water is when you drink it off. Like I drink it first thing in the morning. I drink a lemon water that helps to alkaline your body. Drinking lemon water throughout the day does help you to alkaline your body, which helps you to be in a lower pH. But
Mm,
lemon by itself is very acid. So if you drinking through lemon water throughout the day, it pools on your side of your tongue, of your cheek, and that's when I always say patients with gum line cavities, when they drink a lot of
mm,
lemon water, if you add
mm,
sugar to it, that's bad. So if you're drinking lemon water, drink it down or chug it down within the hour, then drink a lot of plain water to
mm.
rinse out that lemon water from your mouth.
Yeah. Or does a straw help get it back?
Yeah, that is good. So if you have a
Okay.
straw and you can drink it back, it still doesn't, but still you could have a remnants of that be acidic. But
Yeah.
water, drinking through a straw would be better than sipping it. Yeah.
Yeah. Yeah. Great. So what do you do when you have a client that maybe comes in and they have pretty bad teeth, and they talk their meal plan is kind of a lot of sugary and carb filled meals and processed snacks and everything? How do you suggest that they get started on their path to healthier dental care and um, food habits?
Yes. So when we have a patient, when they come in first thing in the first thing to see us, that's the first appointment. My first thing is like not to talk them down or lecture them about what they do. I take the time to gather the data. I'm like listening to them, trying to see what they're saying, hear them out, where they are. Sometimes they are honest and they're like, it's like almost sitting in the confession stand, and they're like, I drink a lot of this, I eat this, I have this. It's almost like it's like they want to say it out before you start beating them down.
Yeah.
But you gather that data, and then afterwards you see related, why are they doing. I'll look in their mouth, and then we do the examination, and then we sit down in the consult. And doing the consult is a time that I go over, I say, you know what, I seems like you, for example, if a patient is talking a lot about sugar craving, and I'm like, I see candida, I'm like, they could probably, it's going to be very hard to give up that sweet craving if you're not controlling the flora of their gut.
Mm,
So they really need to work on their gut flora before, they could be trying their best to control not eating sugar. But if the flora of the gut is messed up, am I helping? I cannot lecture them. Why are you eating sugar? You have to have, everybody wants to do better, but we need to help them to do better. So finding that the right path for them, okay, they're working on it. Um, Especially since we practice biological dentistry, I will educate them, but I'll also direct them to the right path. Like we have some
mm,
networking MDs or naturopath. I'll
Mhm.
tell, you need to work with them so they can see your blood levels, see your different levels of neurotransmitters, see your gut, check your poop and see how the pee is, your hair analysis, and then look into see where you are a little bit in more detail. So that's where we will, and I go over what I do. I like how
Mhm.
like to say, like, okay, try to cut down, like smoking. A
Mhm.
person who smokes wants to quit smoking. The person who smokes really doesn't like smoking, but they do it because they're addicted to it, and withdrawal is very hard. So it's easy to go back to, everybody who smoked has tried to quit smoking once in their lifetime, and they like it's hard. They started it as something to join a friend circle or to
Yeah.
then for to control the appetite, but it's the same thing with food. Like they say, food is such a big addiction that we have.
Mhm.
It really stands on the top of the addiction list. Actually, you'll be seeing drug addiction is not on the top. It's food addiction and sugar addiction is
Mm.
on the top.
Wow. Yeah. Yeah.
Like
I
it
had
is
a couple.
yeah. So we really going back to sit down and talk to them and help them is like it's not so easy to just to go and
Right.
yeah.
Yeah. Little transition, kind of slowly work it.
Help them through, and then that's why they when they come in for the every 6 months hygiene appointment, the hygienist goes over it, so we check. Yeah, so it is a slow transition, is helping them and directing them in the right path, and it is very subjective, it is very individually driven. Yes.
Yeah. Great. What do you think about like artificial sweeteners versus natural sweeteners? Kind of in our, how does that affect our teeth? So like not necessarily the Splenda stuff, but even the honey, and that's still going to be damaging.
I think they're not. I from some of the books and reading and like my own research, I feel that they're not as damaging as your white sugar, as your processed sugar. Honey is actually good. It is used in a lot of medicines in Ayurvedic. It is a carrier for many medicines in Ayurvedic
Mhm.
Eastern medicine. Like stevia is also a
Mhm.
nice natural supplement. Monk sugar is also
Mhm.
a very nice such a substitute that you can use. They're not as negative. The pH of these are not as negative as sugar. So they're actually on a very lower than, from what I know, they are actually on a little bit on the lower end of the
Mhm.
acidic pH.
Okay, nice. That helps.
Yeah.
What is like if one person, somebody was trying to just make one change in their life to get on the path to removing sugar from their food plan, what's one thing they could start with or one thing they could do today to get going on that?
I would say a good probiotic.
Ah, yeah, that's good.
Balance your old microflora and you would be in a better path to, because cutting sugar is not easy.
Right,
Why do
yeah.
you, yeah, see, they always say at 3 o'clock you pray for sugar. It is that time when our melatonin is releasing, so
Mm-hmm.
we do so much thing against our natural body action that we tend to crave more sugar. So I would say start with a good probiotic. There are millions of men, don't ask me, I take, but I take a Biome is the probiotic that I take, and I
Mm-hmm.
have another from True Botanica. That's another probiotic my kids take. But I think when you are having a good probiotic and your good microflora, your second brain is healthy, you think
Mm-hmm.
right, and you stay away from sugar.
Yeah, yeah, yeah. So are there any foods that you talked to a couple other people, but foods that you suggest for instead of taking a probiotic, if people don't like pills, maybe they want to try to get more foods that would help with that?
Yeah, I think probiotic can be in different forms, and I think each culture, if different culture has their own form of
Mm.
probiotics too, like going to, for me, rising, I've been raised in an Indian for an Indian background. We did a lot of yogurt, but dairy is, some people don't like dairy, like
Mm-hmm.
sauerkraut, pickles, they all have probiotic, and they are different form of probiotics that you have, because sometimes I feel like even in the probiotic industry there's a big thing like my probiotic is better, my probiotic is better, but every probiotic, the strength, the strain, they're all different. So I think naturally, if you can get your own probiotic, would be good. If a person is eats dairy, I think dairy has its own kind of probiotic compared to a sauerkraut, a
Mhm.
kombucha. There are many things that they have. So yeah, if you can get it naturally, it would be great. Fermented food, it would be a good form of a probiotic.
All right. A couple different options. Yeah.
Yeah.
Get started on that. So, coming to the end, what is one question that I haven't asked that you really want people to know about your work or cut sugar in your teeth and all that?
Say that again. What do you want?
Uh, so, what is there anything else that you really want people to know about cutting sugar from their diet or related to their dental health?
Okay.
Anything that we haven't talked about yet?
I would go back for me, when anybody wants to cut sugar out of the diet and they're having a hard time cutting it out, go back and look at two things. You got how does your food, what are you eating more, is why you're eating more sugar, and how are you sleeping well. If you're not
Uh,
sleeping well, you are going to crave for that sugar because you're not balanced out. So how a good night's sleep is very important. My dad always said, well, early to bed, early to rise makes a man healthy, wealthy, and wise. So I think it is a still stands true.
yeah, yeah, that's good. And I think I know you guys do a little bit of work with, it's not really on the sugar end, but your dental health and sleeping. Is there like the shape
Yes,
of your mouth
yes,
and
absolutely.
yeah,
Do a lot doing with sleep from kids to adults. So we do focus on a lot because person who's not had a healthy sleep is also not being able to take care of their teeth, not able to eat right, and they don't function really well. And the cognitive, so basically affects the cognitive strength.
yeah, yeah, very important.
Yes.
Yeah. All right. Well, it was great speaking with you. I know you have a little gift for everybody. It's a infographic on sugar in your teeth and kind of things that people might not know how that can affect them and things they might learn from that. So that's really good. They can get that below. But otherwise, how can they find you?
They can look us up online at our website, that is winaturaldentist.com. Or even if they look us up in biological dentistry and look up our name, they can find us. Office number is, in case anybody wants, we are located in Pewaukee. It's 262-691-4555.
Yeah. All right. Yeah. And even if they have, yeah, questions and things you
Absolutely.
might,
And they can
yeah.
that's through Facebook. We are there on Facebook and Instagram. So for the youngsters who want to reach out, I'm not as I don't answer my Facebook. So my daughter and Ashley are the two people who help me answer on Facebook. But if you send us some questions on there, we definitely can help you answer and help see if there's something that we can help you out with.
Yeah. Wonderful. Really great of you. So it's been great chatting with you today, and I know everyone's gotten some great information out of this and things they can take away and go work on their health and teeth
Okay.
and what they can ask their dentist about if they don't,
Mhm.
if they're having issues like this, and maybe finding another dentist. That's another thing. If they are in a different, if they're not in Wisconsin, is there a way to find out more dentists like
Absolutely.
you?
Absolutely. We do have a lot of patients who come and travel to see us. We do have patients come from far away. But the best place to look for a dentist if you are very far and don't want to travel, it's iaomt.org. And if you're looking for a person there, make sure your dentist, you look for a smart accredited dentists. So these are the dentists who have gone through extensive training, because some people are just IOMT members. You do not want to go to them. They are not true biological dentists. And so, and also read up on how much, what they have done, and what the philosophy, the belief is. Yes.
Yeah, yeah. Okay, great. Very helpful. Yay. All right. Well, thanks again for being with us.
Well, very welcome. Thank you for giving me the opportunity to share my views and my ideas.
Yeah. Thanks a lot. Well, and everybody else, thank you for being here. And we look forward to seeing you in the next video tomorrow. Thanks. Bye.
Bye.